Hello to all our viewers out there. This is Bob Willard from the Knee Institute in Regenerative Medicine. I'd like to introduce our guest today. To my left here is Joyce Salvador Willard. And Joyce has a lot of letters after her name. She has a Bachelor's of Science in Business. She also has a Master's in Business. She's also a registered nurse. She also is a certified nurse legal consultant. She's also a certified nurse case manager. She's also a certified traumatic brain injury specialist, amongst a lot of other things and certifications that she has. But we're happy to have her here today, and she's going to be in the capacity of a certified nurse case manager. Sitting next to her is Ann and her husband, Mike, and they're going to be part of our discussion. And what we're going to be discussing today is the effect when we have loss of mobility and significant pain, the effect that it has on our life before and after, and as well as with the family unit there. But in the beginning here, we just want to talk to Joyce, seeing as she is our certified nurse here. Joyce, could you sort of give our audience an overview of what a certified nurse case manager is, what your duties are, and goals and objectives?
Certified nurse case manager, what the duties are is to assess the patient, to find out what the needs are, and to coordinate care for optimal recovery. What it is that we put together a team of experts that will help to facilitate the patient to recover as close to 100% as possible.
Let me ask you a question. How does chronic pain affect the physical and emotional state of patients?
There's many things that chronic pain does affect. It could affect the physical aspect of the patient, that their ADLs or their activities of daily living could be impaired. It can affect their sleep. It could affect their nutritional status. It could add to weight gain on the patient, and also it has a psychological effect for the patient.
When you say psychological effect, exactly what are you talking about?
What it does is that the patient kind of looks at how they view life is through the shades of pain, and that it affects every aspect of their existence from the time they wake up to the time they go to bed at night.
So would some of this sort of involve them feeling down and depressed at times? Things of that nature?
Yes, because they're not able to do what they were used to do when they were younger, prior to their disability.
Well, let me ask you another question. How does it affect their lack of mobility as far as the physical and emotional state? In other words, when they get to a certain point, such as a knee injury, and they don't have that mobility to get around like they used to, and having that in concert with pain, how does that affect them?
It affects their status on if they can take care of themselves, if they're able to really enjoy life and have a lifestyle of doing the things that they wanted to do in the past, like golfing and doing a lot of activities that they were wanting to do but now unable to do, or to do it very poorly. And then if they do the activity, then it causes a lot of pain that stays with them for many days afterwards.
So would we have the similar results as if they're chronic pain and now they've lost their mobility, they sort of get down and frustrated and sometimes angry and sometimes depressed? Is that sort of accurate?
Yes.
Are there any other conditions that you might observe?
Because of their inadequacy to perform their whatever they were doing in the past, it can lead to weight gain, because they're eating and they eat the non-nutritional foods also, which can lead to more weight gain. But once the recovery happens and the pain has lessened, then they look at more activity, and that will help to decrease the weight gain.
And interesting enough, when patients are going through this and they have the chronic pain, we sort of touched a little bit on how it affects them personally. But does this have an effect on their family and their spouses?
Yes, because if they're not able to do a lot of activities that they were doing in the past, then it burdens the spouse in order to pick up what they were not capable of doing, and which it kind of makes them upset too, because they want to do what they were doing in the past. They don't want to burden somebody to do the activities that they were doing, like cutting the grass, or helping with the dishes, or things like that in the home.
Sometimes because of this, does it create some aggressiveness amongst spouses?
Oh,
and
yeah.
anger and frustration and those kinds of things?
Yes. Yes, especially if the couple is retired and they're 24/7 with each other, it's like they want to enjoy life. They want to have a lifestyle that they would be able to do what they want to do, rather than be hindered and only do, well, I only can walk for an hour, so it limits me on where I need to go, so you need to go and do this. So they don't do things together because the one is not capable of.
Do you find that with the spouses and other family members, when they want to do things but they can't do things, that they get frustrated and angry and go, this is affecting my life, this isn't fair to me, why me?
Yes, yes. It burdens the spouse to have some regrets that their loved one, is not enjoying life with them.
Do you find the same kind of things as far as children too?
Yes, yes. Because they're not able to do things with their children or their grandchildren as they should be doing.
Okay. Is it sort of the same kind of response when patients lose their mobility and they can't go up and down stairs and they can't go out and perform duties such as you said, cutting the grass, or just simply going for a walk in the park? How does that happen? How does that affect them? Is it the same as the pain?
Yes, yes. The pain issues are what's hindering the movement, because the patient doesn't want to do the movement because knows that it's going to cause pain, and the pain may be increased for at least for a number of hours to a number of days after they do the activity, so they don't want to perform the activity anymore.
Now, what do you find when patients have gone through this and they have a successful recovery? How do you find their behavior and feelings and activities? How does that begin now, since they've got a recovery period?
They're overjoyed. They've gotten their life back. That then now they can enjoy the things that they want to enjoy, and with their loved ones too. They can be out there doing their activities that they haven't been doing in a number of years, like getting dressed, tying their shoes, walking without a cane, walking without a walker, and the best thing is they don't have pain, so they don't have that burdensome mindset of the pain, and that they're able to really enjoy a better quality of life.
Do you find that spouses and children sort of have a celebration because they're sort of getting their life back too, and they feel very uplifted and upbeat?
Yes, for sure, and it's a gradual process that as the patient starts to recover, then the family recovers also with doing more and it's just a wonderful celebration for everyone.
Do you find that either the patient or spouse or family members come up with this "why me" kind of thing? Why do I have to go through this? Why did I get this? I didn't do anything wrong. Mm-hmm. Do you ever hear that, or?
Yeah, some patients do. If it's a traumatic experience that caused the injury, but if it's a gradual aging process, then it's normal to go through that type of issues, because it is a gradual aging process.
But even being gradual, I used to be able to go up and down stairs, and I can't do it anymore. Why is this happening to me? I'm seeing my friends having no problem going up and down stairs. Mm-hmm. I'm seeing my colleagues at work having no problem out walking their dog. Why does it have to happen to me? Do you feel that frustration, hear that frustration in their voices?
I hear their frustration, but it's what it is that they see that there's some issues that they're having, but it's not like there's nothing they can do about it. They find a way to help them through it so they can get back to where they were. It's not like a why me, this is going to be the rest of my life. It's not, because of the science and the medical field can help to relieve this discomfort so they can get their life back. So it's not a permanent thing for them.